Breathing is something we often take for granted, but our lungs work tirelessly to keep us alive. So, in our episode today, let's discuss how our daily habits and choices affect our lung health. Hi, this is Dr. Lakshmi, and you're watching Yashoda Hospital's The Health Talk session, where all your health related queries are answered here. Joining our episode today, we have a special guest, Dr. Randeep Guleria, renowned expert in pulmonary medicine, and Dr. Nagarjuna Maturu, consultant and interventional pulmonologist from Yashoda Hospital's high-tech city. Welcome to the program, doctors.
Thank you.
So, doctor, lungs are vital organs, but most of us take this thing for granted until we all face a problem with this. So, what are some common problems that we are seeing which are on rise today, and what is the importance of lung health?
So I think the lung is one of the most important organs because if we don't breathe, we are not alive. And every breath counts. And therefore, it's very important for us to keep our lung healthy. What we're seeing over the last few years is a changing profile in lung diseases from what was initially more infections to what is now more non-communicable diseases, which are lifestyle-related diseases, whether it be COPD, chronic obstructive lung disease, asthma, or various other diseases, or because of different habits, even increasing incidence of lung cancer. So there is a changing profile as far as lung diseases are concerned. But overall data suggests that the prevalence of lung disease is increasing, and therefore it becomes more and more important for us to really take measures so that our lungs remains healthy.
So we have seen a shift from infectious diseases to non-communicable diseases today. So what are your thoughts on this, Dr. Nagarjuna?
As Dr. Randeep sir has rightly said, every year we end up seeing more and more number of people suffering from various lung diseases. So asthma and COPD are the two diseases which affect, I would say, lakhs of people in our country. And also, India is now considered the world's capital for both asthma and COPD. And lung cancer. Lung cancer also is one of the diseases where there is a scope for us to prevent, where there is a scope for us to diagnose early, act early, and then change the outcomes.
So talking about how our lifestyle is affecting our lung health, especially in today's world, which is fast-paced, and also our sedentary lifestyle. So how do you think that these factors are contributing to this, doctor?
So I think multiple factors are affecting our lung health. One factor which plays a major role in terms of lung health is the environment. And when we talk of the environment, one of course talks about clean air. And if you look at current data, it suggests that globally, majority of population is not living in areas where the air quality is what WHO advises. There's also data which suggests that almost 200 crore people are exposed to indoor air pollution. And it's very much there in the developing world, where you have a lot of biomass use in rural parts of the country. It's true for India also, although a lot of measures have been taken to try and prevent that. The third important environmental factor in my mind is related to habits. And the habits is basically use of tobacco. So cigarette smoking is also something which we need to really take into account, because when we inhale and when we smoke cigarettes, we inhale a lot of toxic material into our lungs. And this is causing a lot of harm, and it leads to not only many cancers, lung cancer, but more than 10 cancers are directly linked to smoking. And also COPD and various other disorders have a strong link with smoking. And along with that, a new form of smoking, which is known as vaping, and using hookah and things like that, have become very popular in the young generation. And this can also lead to a lot of lung injury. We have vaping-induced lung injury, which is now well recognized. And therefore, there is a need for us to really look at the environment and our own habits if we want to have healthy lungs. And therefore, clean air becomes very, very important, both from a personal point of view and from, let's say, it's a society point of view.
So talking about smoking habits in particular, Dr. Nagarjuna, do you think things like hookah or vaping, which are on trend now, do you think they have some bad effects on our health? Because I'm sure it's a common myth to think that they are safer to do so.
It's a myth, but then unfortunately it is being promoted that way. So the hookah bars promote themselves as a safer alternative to cigarette, which unfortunately is not true. In fact, it is said that a hookah bar could be more harmful than a cigarette. I'll just briefly tell how. So when a person goes to a hookah bar, he stays there for some time. He goes with his friends, he stays there for half an hour, 1 hour, and then is continuously exposed to the environment where that smoke is there. And people don't stop at one or two. They keep taking in that hookah. Hookah also basically has all the same bad chemicals as what are there in the cigarette. So hookah bar, I will not tell is in any way safer than a cigarette. I would put it the other way around. In fact, it might actually be more harmful than a cigarette. To make problems worse is the fact that you get this in different flavors also now. Correct. So as opposed to a cigarette where there is no flavor, you get it in multiple flavors. So people are not used to a hookah. It is easy for them to get addicted to it. Once they get addicted to nicotine, then it's easy for them to switch over to nicotine and other things. So hookah bar, I will not accept by any extent that it is safer. In fact, people have to understand that it is as harmful as cigarette smoking.
And also secondhand smoking or passive smoking.
Yes, that also would be there in a hookah bar to a much larger extent because they're usually small bars. And the very unique thing about hookah bars also is that the pipe through which they take, unfortunately, most of them will not have separate pipes for each individual. So the same pipe will be used by more than one person. So if you end up having a contagious disease which can transmit through saliva, you can even transmit diseases. Forget about tobacco causing diseases. You can also get contagious diseases in these hookah bars.
Just say that there's also a myth that the younger generation feels that, if you go to a hookah bar, it is non-addictive. Many young people say that I just go occasionally, I spend some time and I can give it up anytime. But the constituents in the smoke or the vaping are there to make you addicted to that smoking, and therefore, like cigarette smoke, it is equally addictive. So this should be, the younger generation should not feel that if they go occasionally to a hookah bar, in the long run, it will be something they can give up. They will get addicted to it, and then they go on to more and more serious stuff, which can be more harmful.
So talking about habits in particular, doctor, are there any particular habits that you would recommend for us to follow for our healthy lungs in particular?
So first of all, of course, it's very important that one make sure that the environment is clean and takes measures. So smoking, both active and passive, going to hookah bars or vaping is a big no. You should also make sure that your environment in terms of dust and exposure to other pollutants is not there. So indoor environment should be good. There are also a lot of newer indoor, what is known as modern era indoor pollutants which are coming up because of use of paints and lot of other substances which keep emitting volatile substances in the air. So we be careful about that. Then I think it's also important that you make your lungs more active. So good breathing exercises, yoga is something that we found in studies to be helpful. So breathing exercises to improve your lung capacity is also something that can be done. And a good lifestyle in terms of sleeping habits, in terms of your diet is also something which helps in staying healthy and making your lungs healthy in the long run.
So as discussed earlier, Dr. Nagarjuna, air pollution plays a major role contributing to our lung health. So what are some preventive measures that we could all follow to combat this?
So if you're living in a polluted environment, I think some of the things which we can do is one, to try to wear a mask so that at least the larger particles or the dust which is there, the normal cloth mask or a surgical mask can actually stop. That is one thing which can be done. Second is to try to avoid going out during times when we know the pollution levels are high. And another important thing is, I think it is relevant to people who work in industries, the industrial safety. There are a lot of industries where people are exposed to a lot of environmental dust or smoke, and unfortunately, it is a lot of this sector is still unregulated. So air pollution will affect us, the normal air pollution, the environment where we work, that is another thing which is important. And as Sir has rightly said, indoor air pollution. It's our duty to make sure that the house where we are living is clean. So pollution and all three things has to be addressed.
So that's well said, Dr. Nagarjuna. So now that we all know that lung issues can hit anybody irrespective of their age or gender, so are there only screening tests that we all could take up that you would recommend, Dr. Randeep?
First thing is, of course, know your symptoms. So if you are getting out of breath on mild activity, you need to get yourself evaluated, whether it be from the cardiac point of view or from the lungs point of view. Similarly, if you have a persistent cough which is troubling you for a long time, or when you have a breathing difficulty, you have some sound from your chest which we call a wheeze, you must consult your doctor. We do tests which could include a chest x-ray and of course a lung function. A lung function will tell you about the capacity of your lung. It's important for smokers to be able to do lung function because it'll pick up changes in the lung which smoking is affecting early, and they will be able to really realize that the lungs are getting affected and they should give up smoking. So those who are chronic smokers who are reaching an older age group, it's important for them to get themselves regularly screened. There is also a big program now, small in the West, but being gradually picking up in India also, of low-dose CT scan in high-risk group to pick up for any early signs of lung cancer, especially in those who are chronic smokers and in the older age group.
So I'm sure that post-COVID era, lung health has definitely become a priority for everyone. So what are some vaccines which are available to prevent certain infections, Dr. Nagarjuna?
I think one good thing which COVID has probably done is that the awareness about the importance of lung health is widely present now. People are concerned about the lungs, and the acceptance of vaccines also has increased. So we do have vaccines for certain diseases, but we do not have vaccines to prevent every infection. So we have vaccines for influenza, so which has been there for quite some time. The uptake is still low, but the uptake is increasing now. So it comes annually. So every year the vaccine strains change, the new vaccine comes, and we would recommend an annual flu shot for the high risk individuals at least. The second infection for which we have a good vaccine is the pneumococcus. That is also one of the causes of community acquired pneumonia. So even today the streptococcus pneumoniae, for which the vaccine is there, is still one of the important causes of pneumonia in children as well as in adults and elderly. Then you also have a lot of other vaccines. You have vaccines for zoster, which is recommended in general for all adults. You also have vaccines for pertussis. These are all vaccines which can be taken. But what I would say is that at least if we can inculcate the habit of this flu and the pneumococcal vaccines, you would be able to prevent a set of infections.
So before we wrap this episode, doctors, what's your final message to our audience out there as far as lung health is concerned?
So what I'd like to say is that every breath counts. It's very, very important for us to understand how important our lungs are. And I think COVID-19 really showed that it's very important to have healthy lungs. Otherwise, it affects not only an individual, it can have a major effect on society, on a lot of other things like school-going activities, playing, or even day-to-day work. And therefore, it's important for us to look after our lungs. If we have habits like smoking, vaping, or are constantly being exposed to bad air, we are actually causing more and more harm to our lungs, and at some point in time, we'll have to pay the price for that. So stay away from such habits if you want to have good, healthy lungs. And at the same time, do some regular breathing exercises so that you can actually improve your lung capacity, improve your respiratory muscle function. And I think if you do that, you will have healthy lungs and your breath will be of very good quality.
I would say that a healthy lifestyle is a paramount to both preventing lung diseases as well as helping in getting rid of the lung diseases. So we should all say no to smoking, say no to vaping and hookah, say no to sedentary lifestyle, say yes to a healthy lifestyle, say no to obesity, say yes to being physically fit, and then say no to air pollution, say yes to a clean air. I think with all these things, we would be able to improve our lung health to an extent.
So thank you, Dr. Randeep, and thank you, Dr. Nagarjuna. It was wonderful having you both on our episode today.
Thank you.
Thank you so much, sir.
So this brings us to the end of this episode. Hope this episode was both informative and inspiring. And don't forget to prioritize your lung health. And do join us for upcoming week as well. Until then, take care and stay healthy. Thank you.